Welcome back to Startup Health TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm your host, Logan Plaster. It's my privilege to be here today with Justin Ayars, the CEO and founder of equalityMD. Justin, always good to see you.
Thank you, Logan. Great to be here.
All right, so let's just level set, explain what equalityMD, what are you building?
Sure. Thank you for asking. So at equalityMD, we're matching LGBTQ patients with culturally competent providers in the mental health and primary care space via our virtual-first telehealth platform.
Okay, how'd you get into this?
Accidentally. I'm a recovering healthcare trial lawyer. I used to be on the dark side, defending insurance companies in DC. And then the Great Recession happened. And so I've been an entrepreneur for 14 years now, building up a great network. And I never thought I'd go back to healthcare. But the one question as a lawyer I kept getting from people all across the country was, where can I find a doctor that makes me feel safe?
Okay.
And so when the pandemic hit, I thought I have an obligation and an opportunity to help put a dent in our broken healthcare system.
Okay. What were some of the patient stories that really resonated with you when you thought, we can do something better here?
I can give you a personal one. I was at my dermatologist's office in DC 6 years ago. I'm whiter than paper, so I was concerned about melanoma. And I had to wear one of those awful hospital gowns that nobody likes to wear. And when the doctor put on the gloves to do the exam, I was just talking with him, and I came out as gay. And he said he couldn't complete the exam because he didn't feel comfortable touching my skin. He left the room, and I felt ignored, ashamed, and just miserable.
Wow.
And that is not uncommon.
Okay.
1 in 4 of our community experience discrimination in a clinical setting, causing 1 in 5 never to see a doctor in their life. And that's a problem that puts undue burden on health systems and really hurts families and communities across the country.
Okay. When did you launch the company?
In 2021.
Okay. And what's the market reception been like?
We built our MVP and had some great feedback from patients and providers that really informed our path forward. And so we got into the Cedars-Sinai Accelerator recently.
Okay. Congratulations.
And thank you very much. Still pinching myself about that.
Yeah.
And that's allowed us to really integrate with a big health system and understand the payer landscape a lot better than we did before, so that we can go to employers and help them with an employee benefit platform that's more inclusive so they can attract and retain the most diverse talent possible.
Tell us a little bit more about the Cedars-Sinai Accelerator, what made it impactful for the company?
It was the accelerator of my dreams.
Really?
I didn't expect it to be as good as it was.
Okay.
Yes, there's a cash infusion, but it's never enough. But the mentorship and the ability to understand how a very large, complex health system works, and the education and access to really high-level people that genuinely care about what we're doing.
Yeah.
And the ability for them to see how the solution we're crafting can be installed in different departments across their system and replicated throughout other health systems and payer systems throughout the country is truly remarkable. I didn't think it was even possible.
So you discovered that it really is like a framework and way of thinking. It's not this siloed issue.
Exactly.
Okay. What's next in terms of what does an accelerator like that enable you to do?
It opens doors for us to have conversations that no one in their right mind would ever be able to have.
Like what?
For example, we are now going to do a pilot program with one of the only brick and mortar LGBTQ clinics in the country that's part of Cedars-Sinai ecosystem.
Okay.
We're serving as a trust bridge for a community, an underserved patient population and undermeasured, that they didn't even know they had. We're going to be interviewing 30,000 patients within Cedars ecosystem that they've treated, but they don't know how many of them are LGBTQ. So we're establishing a new baseline by which they can then engage that patient population in a more authentic way to increase patient engagement beyond their initial emergency department experience, and then improve patient outcomes overall.
Interesting. What's that process going to be like? How do you build the trust necessary to do that kind of surveying?
Well, that's a good point. So because we are all members of the community in which we are serving, we've lived the problem that we're solving. Okay. So if Cedars or any large institution came out and tried to do this on their own, it might not resonate with the community as well.
Yeah.
And that's not disparaging of Cedars or Blue Cross Blue Shield or anybody. It's just because of the historical discrimination our community has faced for generations. It's hard for individuals, real people having real problems, to be able to trust the providers and the institutions they're with. So that's why we're able to tack our name onto it in partnership with Cedars-Sinai to hopefully engender a sense of trust that wouldn't be there otherwise.
It's interesting to hear you say that because obviously you started out designing a platform and a tool that was useful, and then when you get into the situation where you realize that trust is a major aspect of the value that you bring. The value isn't just the platform. The value isn't the idea that that trust would become a major value driver.
You couldn't hit the nail on the head any better. It's technology. Everything here is tech, and that's great. And I love tech. We all do. But tech is a tool. At the end of the day, people are the end users, and they have real problems. And if they don't trust the providers or the institutions or the payers, and frankly, in many sense, why would they? Particularly if they've suffered discrimination, they're not going to seek the care that they need because they're not in an environment in which they feel they can be their authentic selves.
Yeah.
So that's why we exist.
Yeah. How does equalityMD differentiate itself in the market? There's a lot of money going towards LGBTQ organizations. There's a desire, there's a conversation at least, so how do you differentiate?
Great question. So there are a lot of great players in the space. Some do fantastic education work, and that's where they stop. That's their strength. Some serve other parts of the community, for example, the transgender community. There are two fantastic companies that do great work serving that patient population. The transgender patient population accounts for about 4% of the broader LGBTQ community.
Okay.
And with about 30 million LGBTQ Americans, that's leaving a lot of other underserved individuals without the care that they need and deserve. So we're filling that gap on a B2C level for the next 2 years, and then on a B2B2C level, selling to health systems, payers, and employers once we build out this truly comprehensive virtual first platform and collect new patient journey data analytics.
Interesting. You have an interesting background with the Chamber of Commerce, and I've always been curious about that piece of your story because it really feels like it gives you a competitive advantage in creating partnerships and in this go-to-market period where you're trying to find organizations to propel your growth. I don't know. What's your through line there?
I often say I built equalityMD by accident.
Okay.
By just showing up, being my authentic self, and giving first.
Okay.
We have a long-standing relationship with the National LGBT Chamber of Commerce. I started a chapter in Richmond 12 years ago. I'm very active in the Los Angeles chapter, and there are 53 across the country.
Okay.
They have over 500 corporate sponsors. And so over the years, I've just been creating really meaningful relationships from local chapter leaders and small businesses to large corporations like Shell Energy and Boston Scientific.
Yeah.
And to be able to have those conversations is remarkable. So our go-to-market solution it's hyper-local, but then it can spread like wildfire organically because we built that sense of trust on the ground level, but also from the top through the people that make the decisions at large corporations that want us to be their inclusive benefit platform.
Yeah. I'm guessing that if you've been having these conversations with organizations like Shell for a long time, or like them, you've probably seen a shift in sort of the authenticity of the desire. I'm thinking about folks that want to show that they have an inclusive benefit platform, and then maybe growing into a place where they really desire it. Have you seen a shift in?
Dramatic shift. So years ago, equalityMD was born out of a marketing and media company. And so I was going around the country talking to Fortune 500 companies about how to authentically market to the $1.7 trillion LGBTQ consumer base, and without waving a rainbow flag. And none of them wanted to have the harder conversation about instilling DEI into their corporate DNA.
Yeah.
And that has to start at the board level. Post-pandemic, suddenly people are waking up to all these healthcare inequities that have been there for generations. And they're realizing that values-based care is a thing, DEI is a real thing, and they're starting to come to us for advice and guidance, and it's a really remarkable thing to see.
Well, you're at a very interesting nexus here in the market, and Justin, I always love getting an update on what you're working on. So I appreciate you, appreciate what you're doing.
Thank you, Logan. It's been fun.